Hello all, and welcome to my presentation on Health Region North for the Baldrige Award application. Health Region North provides health services in rural and remote areas since 1997 for a small population with a large geographic area. We have 15 First Nation reserves, the youngest population in Canada, a lot of health inequities. We're regulated by Accreditation Canada. Our suppliers include the Canada Bulk Purchasing Group, and we foster innovative partnerships with University of Manitoba Centre for Aboriginal Healthcare. Communicable disease is a large concern, with high rates of sexually transmitted infections, or STIs, 40 times the national average. Therefore, youth health is a concern, with a focus on prevention. Our senior leadership have provided our vision to be healthy people, healthy northern communities. Our mission to provide quality, accessible, caring health services in the north. We value respect. We treat all people with dignity. Integrity. Our actions are honest and ethical. Collaboration. We work with our partners to optimize results. Our organizational structure is given in this slide. Our board of directors provides oversight. Our CEO reports to the board of directors. We have a number of VPs, for example, in stakeholder relations, corporate services, programs and operations, and human resources. And the respective departments report to those VPs. This slide depicts the decision-making and communication process for senior leadership. Strategically, our CEOs and Executive Leadership Council have meetings and retreats and communicate via e-communications and bulletins. Operationally, our directors and managers of clinical programs meet via informal and formal meetings. They have e-communications and draft SOPs. We engage our partners through the Northern Health Involvement Group, the Aboriginal Advisory Committee, and engage them through key informant interviews. We engage the patients through patient engagement committees as well as the public. Quality management is integrated throughout all four spheres. Our board of directors provides governance. They are appointed as per the legislation of the Northern Health Act and the Fiscal Transparency Act for the North. We incorporate feedback from patients, families, staff, and the public via our directors' committees. We have a responsibility for the whole of society and therefore foster partnerships with justice, housing, addictions, education, and First Nation reserves. For example, one of our directors' committees is innovation, where we've recently prioritized implementation of a new algorithm to identify only cases of infectious STIs, therefore saving staff time for investigations. Strategy is developed via SWOT. Our strengths include high-quality health services. We're responsive to patient needs. We provide integrated clinical programs. Weaknesses, HR shortages and vacancies. We have a lot of opportunities, strong partnerships, a focus on prevention, a young population, and threats, including an aging workforce and our geography being rural and remote. Strategy is developed through a prioritization journey. We begin with the executive working group. Our board of directors comes up with a straw dog for the mission, vision, and values and strategic directions and priorities. There are consultations with First Nation leaders, patients, public, and the staff. Our interim strategic report is vetted through the local Northern Health Group involvement. There is feedback from surveys on the staff and the public. Our CEOs weigh in, and our board of directors provides their final approval. Strategy is implemented with 4 strategic directions. The first, to improve the health of the northern population. We prioritize a focus on prevention activities and health equity. For example, we track the STBBI rate and the vaccine rate. Strategically, we provide quality, accessible health services in the north. We prioritize improving access to services and encouraging a culture of no medical errors. For example, we track the median wait time for specialists and we report on data on patient errors. Strategically, we want to improve sustainability in the north. We prioritize increasing services near a patient's home and financial responsibility. We track the number of encounters with a specialist, as well as the variance as a percentage of the budget. Strategically, we want to be an employer recognized as the best. We prioritize enhancement of recruitment and engagement of staff. We track the turnover rate and staff engagement survey results. We engage the voice of the customer through meetings with the Northern Health Involvement Groups, meetings with patients and public advisory committees. We engage the public through surveys as well as strategic planning. Customers have been engaged and provided us with the following feedback. From the Northern Health Involvement Groups, we were told that prevention of disease is very important, as well as communicable disease, particularly STIs. From our patients and our public, we received feedback that we need to work on keeping people in the north for their health services, as well as staff recruitment and retention. We use the best possible evidence to make decisions, and this is via a process known as the Northern Health Assessment Process. We use population-level registries and administrative databases to collect our data. These are managed by epidemiologists and data quality specialists. We use a set of 20 core indicators, 10 specifically to meet the Northern unique health needs. Every 2 years, we compile the Northern Health Assessment Report with our partners from U of M Centre for Aboriginal Health Excellence. We identify best practices and we continually incorporate our learning. We foster a certain workforce environment. We want to be an employer of choice in the north, and we want to recruit and retain staff who reflect the diversity that's evident in our population. Teamwork is a valued model for our staff. We foster a respectful and supportive environment for our staff. We participate in ongoing workforce planning efforts to ensure an adequate supply of staff. We use decisions to support our managers. We engage our workforce by continually providing leadership development training for all of our managers to assist them in meeting their employee needs. We conduct root cause analysis of the lowest engagement scoring organizational units and continually resolve root cause issues. Our staff participate in engagement surveys annually as well as strategic planning. Operationally, we align our operational strategies with our strategic priorities. Our first operational strategy to improve coordination of prevention services in the north. For example, we review the role of the Northern Health sites and see how they function within the broader system-wide perspective. Second, we improve the access to services in remote areas. For example, we explore new models of service delivery on First Nation reserves. Third, operationally, we manage resources for improved sustainability. For example, we reduce waste in programs and improve productivity and service delivery near home. We use health data to inform resource allocation decisions. Fourth, operationally, we optimize the management of human resources. For example, we foster a work environment that values our people. In terms of our results, for prevention services, last year, which is represented in the blue bar, we provided 25,000 STI treatments, and that's relative to 10,000 2 years ago, thereby stopping the transmission of STIs in our young people. In terms of access to services, the wait time on First Nation reserves currently is about 35 days, and that's relative to approximately 90 days 2 years ago. Our staff have indicated to us that their level of satisfaction this year, as indicated by the blue bar, is 70%, whereas 2 years ago that was 45%. In terms of the satisfaction of our customers, our clients, in terms of the quality of service received, currently that's 65% relative to 2 years ago where it was 45%. The percentage variance from the budget currently is less than 3%. 2 years ago, it was up at 35%. Our survey indicates that satisfaction with leadership and governance is currently 65%. We're also extremely happy with the number of days for a public health investigation. That's currently 18 days relative to 110 days 2 years ago. We use system-wide integration in order to align governance, operations, always using the best available health information in order to meet our challenges and to improve our strengths in the provision of health services in the North. Thank you.